Hello, I am Dr. Juan Carlos Fuentes. I'm going to talk about the recovery after a rhinoplasty. You can do regular activities, but you need to avoid bending over or lifting something heavy. That's important so you don't swell up too much. Well, because you have a cast on your nose, you should keep the cast dry. So you can take a shower from the neck down, but don't get the face wet. You have to use wipes for your face, and then you have to wash your hair backwards so you don't get wet the cast on the nose. And that is for the first 2 weeks. Diet is important because when you chew too much or hard stuff, you may swell up a little bit more. So a soft diet is important for the first 2 weeks. You may have minimal discomfort after the surgery. We'll give you a prescription for a painkiller, and you need to take an antibiotic also for about a week. Makeup, you can use makeup on your face, just try to be away from the cast. You can do it after 2 or 3 days. It's very important not to smoke after surgery for about 4 weeks because the smoking decreases the healing process. You can drive after 3 or 4 days after surgery. You need to be away from the heat. Try to be away from the sunlight because the heat and the sunlight make you swell up a little more. So try to be in indoor places for the first 2 weeks. By the time you come back and I change the spleen on your nose, you will see your face swollen and the nose is going to be swollen. In a week, only 50% of the swelling is gone. Once you have about a month, about 70% of the swelling is gone. 3 months, 80% is gone. 6 months, about 90% is gone. But it takes about a year before you can tell all the swelling is gone. Exercise. Well, if you do only exercise with your lower body, you can do it after 1 week. If you want to bend over or you face down in the exercise, or you have to do like a jumping or running or swimming, you need to wait about 4 weeks. During the recovery of the rhinoplasty, if you sleep completely horizontal, it's going to be a little hard because your nose is going to get more stuff. So it's important to lay in about 30-degree angle during the night so your breathing is easier, and you have to do that for the first couple of weeks. The follow-up is 1 week after the procedure to change the spleen on the nose. And then I would like to see the patients like about 2 or 3 months later just to check they are healing fine. And from there, I see them 6 months after surgery and 12 months after the procedure.